Hello, social media. This is Katina Kennedy, nurse practitioner, coming to give you some information again regarding some health information that's valuable for your lifestyle. Today, I'll talk about cholesterol. High cholesterol. What is high cholesterol, and what are the complications that can occur from high cholesterol? Well, high cholesterol is basically a buildup of lipids or plaque in the blood, and then it eventually clogs the heart and the arteries of the body in general, not just the heart. When you have high cholesterol, it comes from eating like a lot of different fatty foods, greasy foods, alcohol, because that eventually breaks down to sugar, which turns into a lot of fat, and that also clogs the arteries of the heart. So a lot of fried foods, fatty foods, greasy foods, food that's not good for us, okay? So that's where the high cholesterol comes from. Why is it important to eat healthy foods to avoid high cholesterol? It's because high cholesterol can lead to a heart attack. It can lead to a stroke. It can lead to high blood pressure, because the high cholesterol eventually leads to the clogging of your arteries. And clogging of your arteries, you have arteries that go throughout your entire body. When we think about arteries, sometimes we think about the ones that are in our heart. Yes, we can have a heart attack or a stroke because of our clogged arteries of our heart. However, persons can also have what they call erectile dysfunction. Sometimes when you have a lot of plaque buildup in your arteries, that leads to the inability to maintain or to get an erection. So cholesterol affects every part. Also, we have plaque that can build up in our legs as well. It's called peripheral vascular disease or peripheral arterial disease. So when you have high cholesterol, it affects all the arteries in our bodies, and that causes just the decreased blood flow. When we have the decreased blood flow to our tissues, that causes what they call ischemia, which is just lack of oxygen to that particular area. So we want to avoid just from eating a lot of high cholesterol, foods that contain a lot of high cholesterol, and because that will definitely avoid or prevent you from having erectile dysfunction, cardiovascular, which is heart issues, also leg problems, because if you don't have that adequate blood flow to your legs, you basically can have some swelling to the legs that can occur, some pain that can occur as well because of the clogged arteries. So things that you can do to help prevent high cholesterol. Unfortunately, sometimes it is family history. I have a lot of vegetarians, those who eat very healthy. However, their cholesterol is still high. That's because it's in the DNA. Specifically, the high triglycerides, which is like the fatty part of the cholesterol. I see that's elevated like in a lot of African Americans, a lot of Trinidadians, Indian culture as well. So the triglycerides are the fatty part, and we have to be very, very careful with those, because that's the part that will give us that heart attack. So when the cholesterol builds up on the arteries, I don't know if you all can see this, but I'll just bring it here. Plaque eventually builds up. This is how the artery is supposed to look here. The blood flows through nice and smooth. And then we have a little bit of the plaque buildup because of the cholesterol. It turns into plaque. So when we have that buildup, guess what? That artery becomes a little bit smaller here, and then eventually a little bit smaller. This is where the blood has to flow through. And then here we go. This is total occlusion. And then the blood gets stuck here because it can't go through the artery. And then that eventually causes the heart attack. So for those that are like 40, 45, 50 and over actually, who have high cholesterol, we recommend just a baby aspirin, taking a baby aspirin a day, 81 milligrams, to help just keep the blood thin, so that when it does go through that small arterial space there, it will be nice and thin, and it won't get attached to the actual plaque there and causes that occlusion. So it's important that the blood is thin so that it can just go ahead and nicely go through the artery and go to the appropriate organ that it's supposed to go to. So very important to take a baby aspirin a day. Of course, exercise. Of course, eat healthy. All right, you want to eat foods that's low in cholesterol, a lot of your vegetables, a lot of your fruits. Stay away from the red meat, stay away from the sweets, foods that have a lot of sugar content in it. That can cause the increased cholesterol. All right, so I'm going to stop it there. I could go on and on and on, but things I want you to remember is make sure you go get your cholesterol checked. It's called the Lipid Panel. You have your LDL, which is bad cholesterol, your HDL, which is your good cholesterol. That should be high. And then you have your triglycerides. Your triglycerides should be less than 150. Your LDL should be less than 130. If you have a lot of risk factors, it should be less than 100. And then we have your HDL that should be higher than 40 for men and 45 for women. So healthy high cholesterol, that should be high. Your LDL is your bad cholesterol, that should be low. And your triglycerides should be low as well. So that's just some information regarding that. So go get your cholesterol checked, know your numbers, all right, because that can be an indicator of your risk for heart disease. So go ahead and get that checked. And then also just make sure you live a healthy lifestyle. Your eating, what you put in your body really affects your body. So it's so important to make sure that you eat healthy, you exercise. It really does work. Those who lose weight and exercise, I see a tremendous decline in the cholesterol number. Okay, so it's so important to exercise, eat healthy, get adequate sleep, and of course, get your blood checked. You always have to get your labs checked just to see where you are, and it's about preventative care as well. All right, so I'll stop it here. Again, I could go on and on and on about cholesterol and the effects that it has on our body, but just remember, it affects the heart, it affects the brain, it affects the legs, it affects the penis as well. All right, until next time, make sure you follow me on YouTube, Facebook, and I'll see you next time. Dr. Katina Kennedy, nurse practitioner. Enjoy your day, social media.